Hey folks, welcome back to the Vox Herald podcast. Today, we're diving into a topic that's hitting close to home for millions of Canadians, especially here in New Brunswick. Imagine you've finally got dental coverage through a shiny new federal program, but when you try to get that crown or denture you desperately need, you're told it's been rejected. Or worse, you're waiting months just to hear back. That's the reality for many under the Canadian Dental Care Plan, or CDCP, a multibillion-dollar initiative meant to make dental care accessible for uninsured Canadians. But with 52% of complex procedure requests being rejected between November 2024 and June 2025, and dental offices drowning in paperwork, is this plan delivering on its promise? Let's unpack this together, from the growing pains to the real impact on folks in Moncton and beyond. Stick with us as we explore why half of these requests are getting turned down, who's affected, and what it means for equitable healthcare access in Canada. And hey, if you've had your own run-ins with the CDCP, let us know your story on X. The Canadian Dental Care Plan, launched to provide dental coverage to uninsured Canadians with family incomes below $90,000, was heralded as a game-changer. Fully expanded in June 2025 to include adults aged 18 to 64, it aims to serve up to 9 million people, covering services like cleanings, fillings, and more complex procedures like crowns and partial dentures. But a recent CBC News report reveals a major hurdle. 52% of pre-authorization requests for complex dental work were rejected between November 2024 and June 2025, bogged down by paperwork and processing delays. Administered by Sun Life under Health Canada's oversight, the program is facing what Dr. Bruce Ward, president of the Canadian Dental Association, calls an avalanche of submissions, leading to frustration for providers and patients alike. For New Brunswickers, this issue hits hard. Many in rural areas, like those in the Acadian Peninsula or Indigenous communities, already face limited access to dental care. Long wait times and unexpected costs from rejected claims add to the burden. This story isn't just about real people, like a Moncton senior who hasn't seen a dentist in years, hoping for relief but stuck in limbo. Today, we'll explore the CDCP's challenges, from its historical roots to its impact on New Brunswick and beyond, and ask, how can we make this program work for everyone? We'll hear from providers, patients, Health Canada, and local voices, all while comparing Canada's approach to global counterparts. Let's dive into the background to understand how we got here. To grasp the CDCP's current challenges, we need to rewind and trace its origins. Dental care in Canada has long been a patchwork system. Unlike medical care, which is publicly funded through the Canada Health Act, dental care is largely private, leaving millions without coverage. A 2019 Canadian Community Health Survey found that 35% of Canadians lacked dental insurance, and 22% avoided dental care due to cost. Low-income households, seniors, and Indigenous populations were hit hardest, often foregoing preventive care, until emergencies arose. In New Brunswick, where rural communities like Miramichi faced dentist shortages, access was even tougher. The push for public dental care gained traction during the 2021 federal election. The Liberal Party, led by Justin Trudeau, formed a minority government with a confidence and supply agreement with the NDP, led by Jagmeet Singh. The NDP pushed for a national dental care plan, building on their 2022 temporary Canada Dental Benefit. For children under 12, Budget 2023 allocated $13 billion over 5 years and $4.40 billion annually to launch the CDC, targeting uninsured Canadians with incomes under $90,000. The program rolled out in phases. Seniors over 70 in December 2023, those 65 to 69 in May 2024. Children under 18 and adults with disabilities in June 2024, and finally, adults 18 to 64 in May 2025, with coverage starting June 1, 2025. Health Canada contracted Sun Life Financial to administer the CDCP a $747 million deal to process claims and enrollments. The program covers a range of services: preventive cleanings, sealants, diagnostic x-rays, exams, restorative fillings, and limited prosthodontic crowns, dentures, and orthodontic services. Pre-authorization, mandatory for complex procedures, since November 2024, requires providers to submit detailed documentation, like x-rays and dental charts, to prove medical necessity. Unlike private plans, CDCP fees are set independently of provincial fee guides, and co-payments apply for incomes between $70,000 and $89,999, 40 to 60%. Patients cannot be reimbursed directly. Providers must bill Sun Life. Historically, Health Canada has faced challenges coordinating large-scale health programs. The Non-Insured Health Benefits (NIHB) program for Indigenous Canadians, also administered by third parties, has faced criticism for delays and restrictive coverage. In New Brunswick, the 2010s saw struggles with dental access under provincial programs like Healthy Smiles, Clear Vision, which left gaps for low-income adults. The CDCP aimed to fill these gaps, but early implementation faced hurdles. A March 2024 Canadian Dental Association survey found 61% of dentists were hesitant to join due to bureaucratic complexity and low reimbursement rates. By April 2024, Ottawa relaxed requirements, allowing providers to bill Sun Life on a claim-by-claim basis without formal enrollment, boosting participation to over 70% by August 2024. New Brunswick's dental landscape adds context. The province has about 300 dentists for 800,000 residents, with many concentrated in urban hubs like Fredericton and St. John. Rural areas, including Acadian communities and First Nations like Elsipogag, face long travel times to access care. The CDCP's rollout saw 94,980 New Brunswickers receive care by June 2025, but backlogs in places like North Sydney, NS, suggest similar strains locally. The program's promise of equity is tested by these geographic and administrative barriers. Setting the stage for today's challenges, the CDCP's pre-authorization process, introduced in November 2024, was meant to ensure cost-effective coverage for complex procedures. However, the high rejection rate 52% from November 2024 to June 2025 highlights a disconnect. Providers accustomed to private insurance systems found CDCP's criteria stricter, requiring detailed clinical evidence. Health Canada's Dental Benefits Guide outlines specific requirements, like periodontal charting for scaling or modified handicapping labiolingual deviation index for orthodontics, which differ from private plans. This shift caught many off guard, leading to incomplete submissions and delays. Let's break down the mechanics of the CDCP's pre-authorization challenges and their immediate impacts. The CDCP, managed by Health Canada and administered by Sun Life, covers a defined list of services, but complex procedures like crowns, partial dentures, and deep sedation require pre-authorization. Since November 1, 2024, providers must submit documentation, X-rays, dental charts, periodontal records to prove medical necessity based on Health Canada's clinical criteria. These criteria prioritize basic treatment needs, like addressing active biological diseases, caries, periodontal issues, before approving costlier procedures. For example, a crown might be rejected if decay isn't fully treated first. This differs from private plans, which often have less stringent requirements. The 52% rejection rate, reported by Health Canada for November 2024 to June 2025, stems from multiple issues. First, many submissions lack required documentation. Dr. Bruce Ward noted that dentists, used to private insurance norms, submit what they'd normally send, only to face rejections. For instance, a periodontal screening record (PSR) is now accepted if full charting isn't available. But this update wasn't widely communicated initially, causing confusion. Second, the volume of submissions overwhelmed Sun Life's system, designed for 500,000 monthly applications. An avalanche of requests led to delays, with some clinics waiting weeks or months for responses, only to be asked for more documents. To illustrate, picture a dental office in Bathurst, New Brunswick. A patient, eligible since June 2025, needs a crown. The dentist submits X-rays and a treatment plan, but forgets a full periodontal chart. Sun Life rejects the claim, citing incomplete documentation. The patient waits weeks, unaware their procedure is stalled. This scenario repeats across Canada, with 5.2 million approved for CDCP coverage but only 2.2 million receiving care by June 2025. The gap reflects not just rejections but appointment backlogs, especially in Atlantic Canada. The process itself is rigorous by design. Health Canada's criteria aim to balance cost control with clinical need. For orthodontics, starting in 2025, pre-authorization requires evidence of severe, functionally handicapping malocclusion, using tools like the modified HLD index. For crowns, providers must show the tooth is unrestorable by simpler means. These rules prevent overuse but create hurdles for providers unfamiliar with federal standards. Technical issues with Sun Life's submission software, now largely resolved, added early chaos, with claims rejected for minor errors like mismatched patient names or incorrect policy numbers. CDCP's is 333,333. Patients face unexpected costs. The CDCP reimburses at rates below provincial fee guides, allowing providers to balance bill the difference. For a $1,000 crown, if the CDCP covers $600, a patient with a 40% co-payment, $70,000, $79,999 income, pays $160 plus the $400 gap, totaling $560. Many, expecting free care, are shocked. In New Brunswick, where 20% of residents live rurally, accessing participating providers is tough, amplifying frustration. The program's structure also limits preventive care. Adults get 1 hour of scaling annually, teenagers, just 15 minutes. For patients with years of neglected oral health, Donna Wells of the Canadian Dental Hygienists Association notes that additional scaling requests are often rejected, hindering early intervention. This focus on cost containment risks long-term costs, as untreated issues like periodontitis lead to pricier treatments later. Health Canada and Sun Life have responded. By June 2025, 80% of pre-authorizations are processed within 7 business days, up from weeks-long delays. Educational efforts, including updated guides and provider webinars, aim to clarify requirements. Still, the high rejection rates 49% per Canadian Affairs, 70% for some claims per ex posts suggests ongoing issues with provider compliance and system capacity. Let's hear from those involved. Starting with Health Canada, they defend the CDCP as a landmark effort to close dental care gaps, noting that 5.2 million Canadians are enrolled and 94,980 received care in June 2025 alone. They attribute rejections to incomplete submissions and are streamlining processes, with 80% of pre-authorizations now processed in 7 days. They emphasize that 90% of claims, like cleanings, don't need pre-authorization, and technical fixes have eased software issues. Lindy Vandenberg, Director General of Health Canada's Oral Health Branch, acknowledges the avalanche of submissions but sees it as a sign of demand, not failure. Providers like Dr. Bruce Ward are frustrated. The Canadian Dental Association highlights the program's complexity compared to private plans. With stricter criteria and lower fees, Ward notes that patients expecting full coverage are upset by balance billing. Natalie Marsh, a dental assistant in North Sydney, NS, says clinics are overwhelmed. Booking into spring 2026? In New Brunswick, dentists like those in Fredericton echo this, citing administrative burdens and delays. Yet Ward praises the program's impact, calling it a boon. For those previously unable to afford care, patients have mixed feelings. A Moncton senior, covered since May 2024, told CBC they were shocked by a $300 bill for a rejected crown, believing care was free. Indigenous patients in Elsipogag face additional barriers, traveling hours to find participating dentists. Conversely, some, like a Fredericton mother whose child got free cleanings, praise the program's accessibility. Advocacy groups, like the Canadian Dental Hygienists Association, push for better preventive coverage, arguing that scaling limits undermine long-term health. In New Brunswick, local leaders like Acadian community advocates highlight rural challenges. With 94% of Canadian dentists participating, access is better in urban centers like St. John, but rural clinics struggle with backlogs. The New Brunswick Dental Association notes that low reimbursement rates deter some providers, especially in underserved areas. Critics, including the Canadian Dental Association in April 2024, called the program bureaucratic, with 61% of dentists initially opting out. Ex posts from 2024 reflect public skepticism, comparing the CDCP to scandals like Rejections. However, participation has since risen, suggesting providers are adapting. In New Brunswick, the CDCP's challenges exacerbate existing disparities. Rural communities, like those in the Miramichi region, face dentist shortages. With only 1.2 dentists per 1,000 residents compared to 1.8 in urban areas, the program's backlogs mean appointments stretch into 2026, delaying care for low-income and Indigenous patients. Acadian communities, reliant on bilingual providers, struggle to find participants. Elsipogag, First Nation, for instance, has no local dentist, forcing residents to travel to Moncton. Balance billing hits hard here, where 25% of households earn under $30,000. Nationally, the CDCP's 5.2 million enrollees reflect strong demand, but only 2.2 million receiving care shows a bottleneck. Atlantic Canada, including New Brunswick, faces the worst backlogs due to high poverty rates and limited providers. Ontario and Quebec, with more dentists, fare better, but rural areas universally struggle. The program's $13 billion budget is substantial, but critics argue it's stretched thin by administrative costs and low reimbursement rates. Globally, Canada's approach contrasts with systems like the UK's NHS, which provides universal dental care but faces similar backlogs and provider opt-outs due to low fees. The US relies on private insurance and Medicaid, which covers fewer services than the CDCP but processes claims faster. Australia's public dental system, limited to low-income groups, also struggles with wait times, suggesting Canada's challenges are not unique. The CDCP's high rejection rates and delays risk undermining its goal of equitable access. If unaddressed, rejections could deter providers, reducing participation and leaving rural areas like New Brunswick underserved. Long-term, inadequate preventive care may increase costs, as untreated issues escalate into emergencies. A 2023 study estimated that poor oral health costs Canada $7 billion annually in productivity losses, and emergency care. Solutions include simplifying pre-authorization by aligning CDCP criteria with private plans, Reducing documentation errors. Health Canada could expand provider training, focusing on New Brunswick's rural clinics. Increasing reimbursement rates to match provincial guides would curb balance billing, easing patient costs. Enhancing preventive coverage, like more scaling time, could prevent costlier treatments. Finally, investing in rural dental infrastructure, including mobile clinics for Indigenous communities, would boost access. Folks, the Canadian Dental Care Plan is a bold step toward equitable healthcare, but it's hitting some serious roadblocks. With 52% of complex procedure requests rejected and delays piling up, it's clear the system needs tweaking to deliver for New Brunswickers and all Canadians. From Moncton seniors facing surprise bills to rural Acadian communities waiting months for care, the stakes are high. Health Canada and Sun Life are making strides, but there's work to do. Let's keep the conversation going. Share your CDCP experiences on X and check out canada.ca/dental for updates. This is San Juan, signing off from Vox Herald. The CDCP's challenges reflect the complexity of scaling a national health program by addressing documentation issues, boosting provider support, and prioritizing rural access. It can fulfill its promise. Health Canada recently updated its CDCP Dental Benefits Guide, accepting periodontal screening records for crowns when full. Charting isn't available, effective March 2025. This aims to reduce rejections but isn't yet reflected in official guides, causing confusion. Providers should check Sun Life's website for the latest pre-authorization checklist.